Think about your mother, your sister, your wife, your aunt, your grandmother, or even yourself. Breast cancer. It does not discriminate to age, race, or even gender. Today I'm going to tell you about some of the signs and symptoms of breast cancer, who is at risk for the disease, and what can be done to protect yourself. Let's begin by discussing some of the signs and symptoms of breast cancer that we should be looking for as described on the National Breast Cancer Foundation website in the About Breast Cancer tab. Signs and symptoms of breast cancer can be felt, visible, felt due to pain, or felt by touch. Changes in the breast that may be visible include change in the size or shape of the breast, discoloration, or even scaling of the skin. Pain may be felt throughout the breast to include the nipple area and the armpit area. Finally, probably the most commonly known sign of breast cancer would be a lump. This may be found in a home breast exam or a clinical breast exam. Now that I've established what we should be looking for, I'm going to tell you who actually is at risk for breast cancer. You may be surprised to find who is at risk for breast cancer. Caucasian women have the highest rate of breast cancer, with African American women having the second highest rate for breast cancer, as stated in the Breast Cancer 101 section of the Susan G. Komen website. Although women are at the highest risk for breast cancer, men can have breast cancer too. This year alone, approximately 250,000 women will be diagnosed with breast cancer. Additionally, 2,000 men will be diagnosed with breast cancer. This is why it's important for not only women to be vigilant, but men as well. The age group that's most at risk for breast cancer is those over 70 years of age. But most people that are diagnosed with breast cancer are 40 and over. Now that we've established what we should be looking for and who is at risk, I'm going to tell you a little bit on how to protect yourself. What can we do? What can be done? Many healthcare providers will recommend doing a monthly breast exam at home. Family healthcare providers will provide pamphlets usually that can be taken home, possibly hung on the back of the door or in the shower, that will guide you on how to do a breast exam correctly. I also found in the About Breast Cancer tab on the National Breast Cancer Foundation site a guide on how to do a monthly breast exam. There was actually 3 different ways on how to accomplish a breast exam. In addition to a home breast exam monthly, a clinical breast exam is recommended annually for women 40 and over, and every 3 years for those under 40. Lastly, a mammogram, which is a diagnostic test of the breasts, is recommended initially for women at 40, and then depending on the result of the exam, it's recommended every 1 to 2 years following. Now that I've told you how to protect yourself, let me remind you why. Breast cancer can affect us all. This disease does not discriminate. I've told you some of the signs and symptoms of breast cancer, who is at risk for the disease, and what you can do to protect yourself with early detection. Hopefully with this information, you will feel empowered to go and protect yourself and also to inform others on how to do so. Thank you.